My name is Dr. Norman Matara. I am the current Secretary General for the Zimbabwe Association of Doctors for Human Rights, ZADHR. Today, ZADHR, partnering with the Southern African Parliamentary Support Trust, we are holding an information discussion with health workers in Bulawayo to discuss the Health Service Amendment Bill. As you know, the Parliamentary Portfolio Committee on Health will be going around the country doing information gathering on the Health Service Amendment Bill, and we think that this is a bill that affects mainly health workers, and we need to unpack this bill to health workers so that when the parliamentary portfolio comes to do those sessions, health workers will be well informed, and they can go out there and give their views to the parliamentary portfolio on health. So we have today lawyers who will be unpacking the bill to health workers, and we will then have views of health workers regarding this bill, and then we'll then come up with a report which we'll submit to the committee. In this bill, if it becomes an act, we will see that the voices of health workers will actually be subdued. They won't be allowed to go on industrial action, and I think it's more of muzzling their voices and trying to force them to work under unbearable conditions. Right now, people are being paid very, very low salaries, and some are actually going out of the country because of this. So we think if this bill is to pass on, it's something that will actually increase pressure on people to actually leave, because they will be working under very stressful conditions. The bill, first of all, again, as I said, the Health Services Act of 2005 has not been effective in addressing the challenges that we have been facing as health workers. So they've been caused from different parts. I think from the Hospital Doctors Association, even from us as ZADHR, we've been pushing the ministry to actually amend the act and come up with a commission. And also there's also need to align existing laws to the new constitution. As we all know, in 2013 we had a new constitution. So some of the policies which were in the Health Services Act were not in alignment with the new constitution. For example, the new constitution in section 9, it offers guidelines on how a public administration is supposed to be conducted. And you see that in the Health Services Board, as I said before, the minister is the one who appoints some roles, some members of the board of the Health Services Board. And then once you are appointed by the minister, you are then accountable to HSB. So you have two different masters, the one who appointed you and the one whom you are working under. So that is against the constitution in terms of the constitution section 9 under public administration.